Thank you for joining us for this AdventHealth virtual seminar. We hope you'll find the material presented helpful and informative.
Hi, I'm Alan Gerber. I'm an OBGYN here at Advent Medical Group in Wesley Chapel, Florida, and I'm here to talk about cervical cancer screening guidelines. This is probably the most common question that I get asked in my office is, I thought I didn't have to come every year anymore, or it's every 3 years, or maybe it's every 5 years. So I have to sit down and explain to the patients that what the guidelines are. So I thought this would be a great talk for the community. Just a little bit about myself. I've been practicing OBGYN for 35 years. Currently, I'm with the AdventHealth Medical Group, and I've also been an OBGYN hospitalist for the 6 years prior to this, and I am a board-certified OBGYN. Everybody's used to coming into the OBGYN's office yearly and have an annual exam, which included a breast exam, a pelvic exam, and a pap smear. But things have actually changed as we've learned more about cervical cancer and what its causes are. 80% or so of the cervical cancers are caused by a virus called human papillomavirus, which is sexually transmitted between people. Young women under age 30, if they are exposed to human papillomavirus, they actually clear the virus before their 30th birthday. And then, so the high-risk group of women that we're really concerned about are the women between 30 and 65. And so I get asked a lot, well, does that mean I don't have to have pap smears so often? And I go, no, you really don't. So here are the guidelines. If you're 21 years or younger than 21 years, you don't actually have to have any cytology screening at all. Part of that is because the risk for human papillomavirus causing an abnormality that would be significant is very, very rare. The next group is the 21 to 29-year-old group. And basically, you can do cytology only. So by that, I mean just the pap smear itself every 3 years. We don't need to do HPV screening. And the reason for this is because what was happening is that younger women during this period of time where the virus could go away by itself, we were being more aggressive with them when we found out they had HPV. And so we would do other testing like colposcopic exams, which I can explain in a little bit, and or other treatments to remove any abnormal cells. This potentially could cause people to have fertility problems or even preterm problems once they got pregnant. So the guidelines now are that we do cytology only and don't do any HPV screening. And this is also irrespective of whether the person's vaccinated or not, and I'm going to get to that in a little bit. So the next group of our 30 to 65, this is where it gets a little more complicated, and this is the ages where the patients are more at risk because the virus will tend to stay in the body after age 30 and not leave like it could have when you were younger. So the recommendations are cytology screening every 3 years, which would just be a pap smear, or we use an FDA-approved primary human papilloma virus testing every 5 years with it. So that could be, there's several ones out there. There's actually only 4 out there that are approved. The other thing would be doing a combination of pap smear screening and HPV screening. And that's what I personally use. I think it's just easier to do both. And then after 65 years, you don't need to do any further screening in anybody that doesn't have a history of having some screening results that were negative in the past. So you don't have to have that anymore. And then the last group is the group of women who've already had a hysterectomy with removal of their cervix. No screening needs to be done on them as long as that they didn't have any high-grade or cervical cancer present prior to the hysterectomy. Kind of as an adjunct to that, so the patients, when I tell them this, they say, well, I guess I'll see you in 5 years. And I have to explain to them that, no, you really need to come every year because it's important to have breast exam annually and pelvic exams because we can find other kinds of pathology that we would want to know that you wouldn't have anything to do with the Pap smear. So back in the early, I guess it was early 90s, I think, HPV was identified, and then they worked on a vaccine, and there was a vaccine called Gardasil that came out. And originally the recommendations were to immunize girls 11 to 12 years old. And you could start early as 9 if you wanted to. And that was it. And it took care of the subtypes 6 and 11, which typically actually are the types that actually cause the genital warts. And then also did 16, 18, which were thought of as the high risk HPV types that may be related to cervical cancer. So, but as time progressed, we realized a couple things. One is that it was important probably to vaccinate males also, because not just because they infect females, and but because they also were at risk for other types of cancers. Anal genital cancers and also head and neck cancers are being identified. And they also identified several more types, 31, 33, 45, 52, and 58. Some of those are related to each of those types. They expanded the time from, it was 11 to 12 years age to 26 for females. Males were added, and we also, there's people that are not over 27 years old to 45 who had a low exposure to HPV prior, but maybe be in a new relationship, and they might be at higher risk now, or can get vaccinated also. And it's a 3-shot series. On the first day, 2 months, and then there's a booster at 6 months. And it has very low side effect profile. The most common thing is just a sore arm at the injection site. Wrapping it up, I would say basically, Pap smears are a very important part of women's health care, and that these new guidelines are really are good for patients. We're not going to be over-treating women for abnormalities that may not be significant, and that also helps prevent potential complications from over-treating. Well, I'd like to thank you for your time today, and certainly I'm sure you can find a way to find me if you have any questions. Thank you. Have a great day.